Hello everyone. For this demonstration, I'll be simulating a patient who just had an abdominal surgery, a midline incision through the stomach. To represent the patient, I'll use this as my abdominal area. So before applying the dressings, I would clean the surgical site. First, I'd remove dried blood or fluid with sterile gauze or saline. Then I'll apply an antiseptic solution such as betadine or chlorhexidine to reduce infection risk. Here, I'll use a damp paper towel to simulate cleansing and a spray bottle to represent my prep solution. Again, I'll apply the first layer directly to the incision. This napkin represents a 4x4 non-adherent dressing like Adaptic or Telfa. I'd use 2 or 3 4x4s stacked to fully cover a midline incision. This prevents sticking to sutures and protects the wound. So, since abdominal surgeries often involve drains such as a Jackson Pratt or Hemovac, I'll also apply a separate dressing for the drain site. This folded paper towel represents a drain sponge with a slit. It absorbs fluid around the tube and keeps the drain site clean. So now that it's stacked over the non-adherent dressing, I'll place this larger paper towel to simulate an ABD pad. ABD pads are designed for heavy drainage, which is common in abdominal procedures. They absorb excess fluid and provide bulk protection. And on top of the ABD pad, I'll place this cloth to represent a soft roll or gauze wrap. This adds cushioning, distributes pressure, and helps keep the lower layers from shifting. And finally, I'll secure the entire dressing with household tape, simulating surgical tape. If this were a large abdominal wound, I might instead use an ACE bandage for a circumferential dressing to keep everything in place. So the final recap of the layers that I applied were non-adherent dressing, drain sponge, ABD pad, protective roll, and tape. Each layer works together to protect the incision, absorb drainage, and promote healing. So these completes my simulated abdominal dressing. Each layer is applied in order to protect the incision, absorb drainage, and ensure secure healing. Thank you so much.